Our first patient is Amelia. She is 32 years old and was treated for Hodgkin's lymphoma when she was 17. Her treatment included chemotherapy and radiation to the chest area. We asked her to come in today specifically to discuss her cancer history and survivorship issues in more detail.
Hi, doctor.
Hi, Amelia. Nice to see you again. Thanks for coming in. We've talked through your Hodgkin's treatment before. Do you have any questions or concerns about your treatment or health after cancer?
It's been 15 years since my treatment. I was told I'm cured, but because of the treatments, I have an increased risk of getting breast cancer. I sometimes wonder what else the treatment did to my body.
When patients like Amelia receive radiation treatment at a young age, they are at risk of developing subsequent cancers in prior radiation fields, usually 10 or more years after treatment. Depending on the dose, some women treated with chest radiation for childhood cancer have a similar lifetime breast cancer risk as that of women with a BRCA1 mutation. International guidelines for adult survivors of childhood cancer recommend regular screening with alternating breast MRI and mammogram every 6 months, starting at age 25 or 8 years after radiation, whichever is later. Discuss this with patients so they know why and how often they should be screened.
What about other issues, like heart attacks? My dad and my uncle had heart attacks. Am I more likely to have heart problems because of my cancer?
Patients treated with chest radiation at a young age are at increased risk for multiple cardiovascular complications. Some patients need valve replacements at a younger age than is typical in the general population. Certain chemotherapy drugs, such as anthracyclines, also increase the risk of cardiomyopathy. Amelia had chest radiation and anthracycline chemotherapy. While her family history is significant, her cancer treatments confer a greater risk for heart disease. There are cardiovascular guidelines for adult survivors of childhood cancer treated with chest radiation and/or anthracycline chemotherapy. Talk to your patients about modifiable cardiovascular risk factors, regular echocardiograms every 5 years or more often if symptomatic, and the possibility of a cardiology referral if the echo is abnormal. Encourage healthy food choices, exercise, and smoking cessation if needed. In addition to discussing late effects like cardiovascular disease, we should discuss potential fertility late effects. We can start by asking Amelia if she has considered having children.
Actually, my husband and I have been married for 2 years and are ready to have kids. My husband wanted me to ask you if I need any extra testing because of my cancer history.
Discussing fertility and family planning is important for cancer survivors who were treated as children or young adults. Many may not be aware of the risk of treatment-related infertility. It's never too early to discuss these issues because there is potential for progressive fertility decline and survivors may want to consider fertility preservation. Prompting your patients facilitates conversations about topics that they may not bring up directly. Be sure to make the opportunity. Just ask. The risk of infertility after childhood cancer depends on the type of treatment, age at treatment, and time since treatment. Some chemotherapy drugs like alkylating agents and radiation involving the ovaries or testicles can cause diminished ovarian reserve, premature menopause, or impaired spermatogenesis. This means that patients may have difficulty conceiving or may not be able to conceive at all. Prior radiation to the abdomen and pelvis also increases risk of preterm labor, low birth weight, and fetal loss. With so many factors affecting fertility, there is a lot of uncertainty about individual risk. Help your patients navigate fertility concerns. Ask their oncology team for guidance about risk prediction of premature gonadal failure. Refer to gynecology, urology, and/or reproductive endocrinology for specialized testing, including genetic counseling if applicable. Provide patient education resources about fertility and family-building options. Alternative family-building options include IVF, egg or embryo freezing, donor eggs or sperm, surrogacy, and adoption. These are complicated decisions that deserve dedicated discussion.
I've heard that stress decreases women's ability to get pregnant. I'm always so anxious before my appointments. I can't sleep the night before, especially if I'm waiting for any test results. Maybe I worry too much.
It is very common for anyone who has been treated for cancer to worry about their appointments. Cancer survivors have coined the term scanxiety to refer to the worry felt before testing and while waiting for results. You have likely sensed the palpable tension that some patients feel at their visits. If you have known or loved somebody who has had cancer, you may have experienced this as well. Every patient may experience this differently. Worries can be mild and infrequent, but for some, they can be severe, persistent, and debilitating. No matter how long it's been since treatment, we can support survivors by validating these emotions, minimizing wait time for results, and referring patients in severe distress for specialized mental health care. Patients often tell me they are reassured when I explain that many survivors feel the same way they do, that I can understand why they feel like this, and that we can work through it together. As you've seen, there are a lot of potential late effects after childhood cancer treatment. Keep in mind that some people may not have any of these complications. To best individualize care for adult survivors of childhood cancer, we need to know the details of their cancer history, the specific chemotherapy drugs, radiation field, and age at treatment. Some survivors will have a survivorship care plan prepared by their oncology team. A survivorship care plan includes information about past treatment and recommendations for ongoing follow-up care. If your patient does not have a survivorship care plan, you may consider encouraging them to create one with their oncology team or on their own using online resources. You could also use our note framework to gather particularly relevant details yourself. The framework lists topics you can ask your patient or their oncology team that can guide survivor care. Amelia's case demonstrates that adolescent chest radiation increases lifetime breast cancer risk and requires early high-risk screening. Chest radiation and some chemotherapy treatments increase cardiovascular disease risk. Early screening and treatment of modifiable risk factors is critical. Some chemotherapy and abdominal radiation can cause progressive fertility decline. Start fertility discussions and consider specialty referral. Anxiety about visits, tests, and test results can persist for many years after finishing cancer treatment. This concludes the first case. Please advance to the next case.